You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. My first guest, she's been on the program before, and she's here to talk about the newest technology that is really taking the cosmetic surgery, plastic surgery world by storm, because it can almost create a facelift without surgery. It's called Ultherapy. She's a medical esthetician, Danielle. Welcome to the program.
Hi, Randy. How you doing?
Good, good. I had you on the program 3 years ago.
3 years ago.
You look younger today.
Thank you.
Than you did then. And so Ultherapy is hot. What is it for people tuning in? I mean, what is it?
So Ultherapy is a non-invasive procedure, no downtime. We're using focused ultrasound technology to heat the underlying tissues of the skin, resulting in tighter, more like a shrink wrap effect of the face. So if you have any loss of elasticity, maybe you're losing the jawline definition a little bit, we're gonna bring that back. We're gonna tighten and lift the skin, non-invasive, no downtime. It's great.
And you told me, I guess one of the prettiest, most attractive 60-plus-year-olds in the world, Christy Brinkley,
yes,
is a spokesperson for this technology.
Yes.
Ultherapy.
She just came on board as the spokesperson for Xeomin and Ultherapy. And so it really doesn't get much better than that.
I mean, everybody tries to figure out how the heck she looks so good.
And she looks fantastic because you can tell that what she's done over the years is maintenance, little by little, not a big overhaul. You know, she didn't wait until things got really bad. She started younger, and just by doing little things here and there. And it's when you do it that way, you get a much more realistic version of yourself, a better version, a younger version, but people aren't going to say, oh yeah, she had this done and that done. It's more like we're wondering, what did she do?
So this radio frequency heats the face, like goes deep into the tissues.
It's not radio frequency, it's ultrasound technology.
But it does heats
yes.
the face.
We're delivering heat into the underlying tissue. And we can go, when I put the applicator on the skin, it projects an image onto the screen. And on the screen, I can see bone, I can see nerves, I can see collagen. It's great. So I know exactly where I'm delivering the heat into the tissue. And over the course of 6 months, that's when you'll see gradual changes. And you come back in and we compare your before and after photos. A lot of people will say maybe they haven't seen a friend or a family member in several months, and they'll say, no one can tell that I had anything done, but people were wondering, are you sleeping better, or are you eating better, exercising more? Which is nice because no one wants to look overdone. People just want to look like a better version of themselves.
I was talking to Mo Zachary, Dr. Zachary.
He's the best.
And he was saying, what's your favorite procedure, non-surgical procedure? He goes, I love Ultherapy. Mm-hmm. It works. And
tell me about your experience.
Okay, yeah, I've had it.
Who did yours?
You did mine, but my neck, it pulled in my jowls in my neck. When I look at before and after photos, it's great. And I want to schedule, like I told you, I want to do it again.
Great, come on in.
And it's nice, you numb us up, feel good.
Right.
For men, I guess it could have a little bit of pain, but
everyone's
But there's
comfort,
no downtime at all.
No
zero.
downtime. And everyone's comfort levels vary, but it's a very easy procedure to do. You're in and out, and especially for men, because as you age, and I know your age, Randy, and you look fantastic. Okay. We start to get some volume down here, and we lose that jawline definition. It's a problem for most people, women and men. About a year and a half ago, I worked on, have you ever seen Seinfeld?
Yes, of course.
Remember Elaine's boss, Jay Peterman?
Jay Peterman,
so
yes.
John O'Hurley.
Good-looking guy, nice guy.
Good-looking guy. He came in, and he wanted to do a procedure to tighten the skin around his neck. So we did the Ulthera, and we'll show some pictures later of what he looks like now. And he looks great.
So men and women, a lot of women are doing, so what? It addresses the jowls. What other areas of the face are you doing?
Full face and neck and chest. So there's 3 different depths of the skin that we treat. Right above the muscle up to very superficial, like 1.5 millimeters under the skin. So I always talk to patients and say, think of a bed. Okay, so you have the bed frame, you have the box spring, and you have the mattress. Those are the 3 areas that I'm treating with Ulthera. Then, if you want to treat wrinkles, like the deeper set wrinkles, maybe some sun damage, age spots, things like that, you can use topical treatments. You can do like skincare. SkinCeuticals has some great antioxidants and hyaluronic acids. You can also do laser. That's kind of the bedding, you know, the pretty bedding. So you can incorporate laser with Ulthera, microneedling. It's also, I tell patients, it's like when you go to the hair salon. You go to the hair salon, typically for women, we get our roots colored, we get highlights, we get a blow dry, deep conditioning treatment. It's the same thing. Whenever you combine treatments together, you get a better result. It's not like coming in and getting one thing done and expecting huge changes. You get better results whenever you pair it with something else.
Now people are calling it, you know, at least my plastic surgeons are calling it the non-surgical facelift.
Yes, that's what it's known as, the non-surgical facelift.
And how many times a year do you get this done? Because you told me you want to get it done once a year.
I do. I've had it done 4 times. So I do it once a year, maybe once every year and a half, depending on my schedule. And some people get it done once. Some patients like to do it once a year, like myself, just to keep the collagen intact. I think it's better to prevent and maintain than it is to correct and maintain. I'd rather not wait until things get really bad. I'd like to just kind of keep things the way they are, and maybe keep improving. And you can do that with Ulthera and with, you know, other treatments, as well as topical treatments too.
So what are the areas that you focus on?
Full face and neck. Let's start with the brow. So when we work on the brow, if you have maybe some excess hooding or skin, we're going to lift that up. And even bagginess underneath the eyes or puffiness over here, we're going to lift up this skin. And if this area is a problem for some patients, which a lot of us have this area, the nasolabial folds, we can lift this, and you can also get some more definition in the cheekbones. Underneath the chin is a big area. No one likes a turkey waddle.
Yeah.
And of course the neck and chest, a lot of people sleep on their side and we get the vertical lines, and this helps soften that too.
So the area, you call it the décolleté area.
Décolletage.
But it's red and there's wrinkles on it. How does the Ultherapy help there?
So speaking from my own experience, you know, it's frustrating because as a female, whenever we get dressed up, you know, we have our face and our neck one color, and then a lot of patients forget about the chest. So you'll have a lot of sun damage that maybe wasn't treated when you do face and neck procedures. So the Ultherapy is going to help tighten the skin, plump up the fine lines or deeper set wrinkles. As far as the redness, that's more of a laser.
Like intense pulse light combination with
broadband
Ultherapy.
light, intense pulse light. It's great to pair them together, and you get fantastic results.
So we are out of time, but as an esthetician, is this your favorite procedure?
Yes, Ultherapy is my favorite procedure because unlike other procedures, this actually gets better with time. So the longer you wait.
What does that mean? What do you mean over time?
So it takes a while for your body's collagen to be stimulated, and so this is a very natural result, and it's gradual. So this is great if you have an event, if you have, you know, a reunion coming up or a wedding or something special 6 months from now. This is something great to do now because in 6 months, this is when you're going to see dramatic results.
But it seems like you look tight that night. Like, for example, I had it done with you.
Yeah.
And there's no bruising or anything like that, but you feel like you called it shrink wrapping.
Yes.
I mean, I felt it and saw it immediately.
You do feel the effects immediately, and you know, whenever you come in for the treatment, I give you a what to expect after. I tell you what to expect that night, the first week, the first 30 days, 60 days, and 90 days. So we really map it out for you so you know exactly what to expect, and you have all the knowledge that you need.
So Ultherapy is the brand. Is that what the patients call it?
Ulthera, and the procedure is called Ultherapy.
So Christy Brinkley is giving credit for
Yes,
her great
she is.
looks
And she
with
looks
Ulthera.
fantastic.
Okay, good. Well, I want to thank you for coming on the show.
Thank you for having me.
And next time we'll have you on for a little bit more time because I know
Sounds
this is
great.
a big topic. Thanks again.
Thanks, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, micro-needling, looking years younger without surgery. We have a medical esthetician. She's from the Cosmetic Surgery Institute. Many of you know the board-certified plastic surgeon, Dr. Mo Zachary. She's part of that team. And with us we have Karen Nystrom. Karen?
Hi,
Welcome
Randy.
back to the program.
Thank you.
Your skin's looking good.
Thank you so much.
Now you're in your 40s, right?
I am.
And your skin looks really good. You look much younger than
Thanks
your
so
age.
much.
So you're dipping into your own stuff?
Microneedling and chemical peels.
Is that right?
Mm-hmm.
So what is microneedling and what are the results you're seeing?
Microneedling is actually for all skin types. It is better for texture issues. It is using a pen to collagen induction therapy that goes in and out of the skin with several needles on it, and that induces the collagen production. Yeah.
So they're tiny little microneedles?
Microneedles, and they go in hundreds of times all over the face. Very minimal downtime. When you leave, you're pretty red, but by the next day, you could go out and on the town and look great. And the results we're seeing are just phenomenal. With people that have pitting or acne scarring or scarring from just post-surgeries, it is reducing that completely. Also for stretch marks, but wrinkles too. So it's great anti-aging as well.
Now, under the eyes.
Under the eyes.
I guess you are
we can go all the
combining
way up
it
to the eye.
with PRP, with platelet-rich plasma. Is that true?
We are. It's otherwise known as the vampire facial, which you've probably seen with Kim Kardashian and so forth. But we take your own blood and we spin it in a centrifuge and just get the plasma that's very rich in growth factors and stem cells. We apply that to the skin, and then we are going to do the microneedling over that, and then you reapply it. So basically you're getting the benefits of the microneedling, which creates some trauma and then produce the collagen, but also all the growth factors that are your own and your stem cells to regenerate quicker with a lot better quality results.
Now, it's not painful, right?
You do come in a half an hour prior and you put on some numbing cream. No pain whatsoever. Afterwards, you could feel some heat that evening, but by the next day, zero pain.
Is the downtime like minimal?
2 days, top. You know, that's it.
Now,
2
your
days
skin
tops.
is good. So you do
Thank
it on
you.
yourself, or you have somebody, Marissa?
That's the one
somebody...
thing I can't do to myself.
Okay.
That I need one of the other girls to do.
How often
it
do
on
you
me.
get microneedling?
You're supposed to do 3 in a row to have the best results. In conjunction, they work much better and greater, the collagen production. And you would do those typically 4 to 6 weeks apart.
Okay, now I asked you at the beginning, I said, you must be doing a ton of laser. And you said no.
No, I've only done one BBL treatment, broadband light, for the brown spots, and that was several years ago.
So you have it's purely just a lot of microneedling, chemical peels, things like that.
Microneedling chemical peels is my thing.
Do you think estheticians that are underestimated as far as what you can do for results?
I think definitely. I think there's just so many newer, more innovative things that are coming out that allow us to do things that actually are going to create some trauma to the skin that then will produce a lot of collagen and anti-aging results that last forever.
Okay, so we know you're in your 40s. Yes. 10 years from now, do you think you can maintain this look?
I think if I put some old therapy in there and maybe some fillers, yes.
Yes, okay, good. So final message to anybody that's actually maybe looking for an esthetician. What do you say about your team and what you're doing there at CSI?
We're like a family. We are the best crew. It's the doctors we work for are just absolutely amazing. So it's the best place, and I would never leave it there. That's why no one ever leaves there.
Is that right? That's right. Once you book an appointment, you're stuck.
Or once you work there, you don't leave.
You don't leave. Okay. Well, I want to thank you for coming on the show.
Thank you, Randy.
And your skin looks great.
Thanks
and
so much.
Next time I want you to bring in some more of your photos.
Okay, perfect.
Of what you can do with microneedling. So is that what they call it? They just call and say, I want microneedling.
Microneedling, especially for people that have the pitting and the pock marks. It's amazing, the results. And the before and afters, we will definitely show you those.
Okay, good. Thanks again. You're watching The Wellness Hour. We'll be right back. You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. We've had her on the program before. She is the desert's go-to laser nurse. We have Adrienne Bloom. Adrienne, welcome back to the program.
Thank you, Randy. Happy to be back.
Now, I know you brought photos today, and these are probably the most dramatic photos you've ever brought on the show. But you were on my program 8 years ago, and you almost haven't aged. It's not an exaggeration. I think if people put them side by side, they haven't aged. So you're dipping into your own stuff.
I am dipping into my own stuff, and my patients haven't aged either.
Is that right? Okay, good. So what's changed in the last 8 years?
Results. What I'm able to do today, I couldn't do in the past. I'm able in one afternoon to take somebody's face and make them look 5 to 10, even 15 years younger.
In one visit.
Hour.
Because you told me in the green room, you said, Randy, I can make somebody look 5 or 10 years younger in just one visit.
Right.
And some of the photos prove it. You brought very dramatic photos today.
I did.
So what's new? I mean, what new technology? I mean, you guys have a full laser center there.
We do. The technology has changed, but figuring out how to use the technology is the difference.
All right.
Somebody comes in with sun damage. We're not just using just a broadband light. Maybe I'll add a little fractional into it. I'll add a laser peel into it. And with these treatments, we don't have to go as deep anymore by piggybacking and using different lasers for specific needs. So really it's an art of getting the results that each particular person needs.
So you've been doing this a long time. I mean, you've
have.
done thousands of these procedures.
have.
What does experience really mean to the patient?
Being able to push the laser, being aggressive with the treatments,
Okay.
and using the right settings, the right parameters, and figuring out their specific needs and their specific skin type, and then using the right modalities and the right parameters to achieve the results that we want to achieve.
So it's very common, you're always doing a combination of procedures.
Absolutely. All the time. All the time.
All right, now you brought photos. What are we looking at here?
I did. So first I wanted to talk about this woman here. She came from the era of baby oil and iodine. She had a lot of sun damage on the skin, just years of accumulated sun damage, deep lines, folds, wrinkles, hooding on the top of the eye. So when she came in, she just wanted to really revamp and do something with her skin, but she didn't know what she wanted to do. She didn't know if she needed a facelift. She didn't know if she needed to, what direction to take. And that's a really common thing with patients when they come in for their initial consult is, what do I do? There's so many treatments out there. What is the best thing for me?
So when you look at her face, what are you thinking?
I'm thinking a full face resurfacing. Okay. Let's push the reset button and let's take the skin down and really just get down to that healthy, normal skin again.
So when you see her, I mean, you've been doing this long enough where you, like in your mind, you know where she's
Absolutely.
going?
Absolutely. As soon as we sit down for the consult, I'm already analyzing and the brain is going, thinking of what I need to do and what we can do together to make the skin look its greatest. So with her, this is what we did. If you now see the after picture, complete difference in the skin. The texture is improved. If you look at the eyes, the skin above the eyes, and especially the cheek area, it almost looked like, and she had some acne scarring before, and now the lines are gone. So look at the upper lip on the before and the upper lip on the after, and especially around the mouth. She looks like a different person. She's a funny character. She said that now at her work, she's getting hit on by 23 and 24-year-old men. Okay. And she's just as happy as can be. And just people look at her and go up to her and say, "What did you do? Something's different, but we don't really know what it is, but they notice something is different." And I think she looks about 10, even 15 years younger. She feels like a different person.
And how many treatments is this?
This is one treatment.
One treatment.
And what we decided to do is I wanted to do a full face resurfacing. I wanted to basically, in a lack of better words, take down the upper layers of skin. I want to bring that down. If you think of a line, it goes like this. We want to take down the edges of that line and get to the base. Then at the same time, and here's where the piggybacking comes in, I want to take the fractional laser and puncture holes into the skin to get those deeper layers of skin to come up. So as we're shaving the skin down on the top, we're bringing the bottom of the foundation up.
So
to
the
meet in
collagen
the middle.
breaks through, fills in the lines?
Well, there's holes that are punctured into the skin with heat. Okay. And it only treats 11 to 22% of the skin in 1 inch. So in that 1 inch, all the rest of that tissue that wasn't treated is viable tissue. So what the body does is it sets off a wound healing cascade. So another thing happens with the combination treatment. The skin continues to produce collagen. We used fractional on top of the full face resurfacing. And with the fractional, it's kind of the gift that keeps on giving. In 6 months, the skin continues to produce collagen. Over the next 6 months, even 9, 10, 11, 12 months, the skin continues to produce collagen and it starts to build a foundation under the skin. So not only have we taken off the top and tightened, the skin underneath has viable tissue that's regenerating and building collagen and elastin, which we lose over the course of years as we age.
Now we should mention, I mean, you are a fanatic about learning all the new stuff.
I am.
Right after this interview, you said you're getting on a plane to go to...
Rebecca and I are flying to Dallas right after this interview. Our plane takes off in a couple hours. It's the world's largest user summit for laser. It's a laser convention. There's 16 dynamic speakers, and I'm just going there to learn the new technology and bring it back to the office. Maybe even buy a new laser. Dr. Mo Zachary, he's a perfectionist. He wants to make sure we're offering the best of the best, and he is so supportive with our continuing education and bringing back the latest technology back into the office and staying on the cutting edge of laser treatments.
Now we should mention, look, people need to know, I'm not endorsing you on the show, but in a way I am endorsing you. As you know, I've sent loved ones to you.
You have.
I've
Thank you.
had a few treatments from you.
You have, yeah.
Laser and things like that. And now somebody that was scheduled for a facelift, we're going to snag them from San Diego, and you know, and I'm
Bring them on over.
sending them to you. And I have access to go to any place.
Thank you.
But the truth of the matter is, when I look at before and after photos, yours just are a little bit better.
Thank you.
There's no doubt about it.
Thank
Now,
you.
do you get recognized in the desert?
I do.
From TV?
I do. They always, it kind of depends on when the show airs, but I hear it a lot.
Do they ask about me?
Never.
All the time? Never? I'm just kidding. Okay, you have more before and afters.
I do have more before and afters. So now I kind of want to focus on the eye area. Okay. So in 1 hour, we can, without surgery, we can take the skin around the eyes and have it almost look like you had eyelid surgery without the surgery.
Okay.
So I want to show this picture. This woman had a lot of, we call it hooding on the top of the eye. It's a lot of skin. So she came in and she said that she looks tired. There's a tipping point. You sleep 8 or 10 hours at night and the next day somebody says, "Are you tired? What's going on?" We don't want to hear that. Nobody wants to hear
Right.
that. So in her case, I'm looking at her. She thinks that she might need eyelid surgery. And I'm looking, thinking, gosh, I can get a lot of that skin down with just one laser treatment. And we did.
Let's take a look.
We had her come in.
Wow.
Yeah, big difference. If you look under the eye, all of the bags are gone. The upper lid, before she had maybe 3-4 folds, a lot of the hooding. She just has the one lid above the eye, and just overall.
And that's just with a laser.
That's just laser, nothing else.
Is that right?
Absolutely.
Now, you know, people touch up their photos on Facebook. I never do. No, I'm kidding. But it almost looks like a blurred. So this has not been touched up.
It has not been touched up at all. That is raw picture. She's very happy. And now we put her on a program. She can have some filler with Peggy, gets great skincare with the other girls, some microneedling. And now I want to show the full face. I want to span out of it a little bit so we're not just focusing on the eye area. The full face, if you notice all of the sun damage and the forehead lines and the lines around the mouth, her jowl area, it all tightened and just got a lot more youthful. And this is without makeup. Once she puts on her makeup, it's going to look even better. And go on smoother, the pores will be less visible, and just overall, she had a wonderful, great result, and she's very happy with it.
Are people surprised at these results? Are you ever surprised?
I am, actually. I go, wow, that turned out a lot better than I even imagined, but everybody, very, very happy.
Okay.
So the next one, so here's a guy who came in, works a lot, doesn't want any downtime, but had a lot of wrinkling under the eyes. We decided to use broadband light and fractional, combine the two treatments together, and really focus on the tissue around the eyes and the texture of the skin, which this particular treatment, I have to be honest, actually surprised me as well, because the settings were so light, but by combining the two different lasers, we got a lot of tightening.
This is very nice.
A lot of rejuvenation around the skin. Thank
It's like you wiped out the wrinkles under the eyes.
We did. He's very happy, and he said he was back to work in 3 days. He's in the public eye. He's very busy at work. For example, Randy, 2 twin brothers go for an interview. One looks a little more tired. The lines around the eyes are more noticeable.
This looks exhausted.
He looks exhausted.
Okay.
Who do you hire? The one that looks a little better.
Energy.
Right. Yeah. The skin is a little brighter and tighter. It makes a difference in a lot of different aspects. But another thing that happens, it boosts their self-esteem. They're back in the gym. They're doing other things that make them feel good. It's almost life-changing.
It's like the Bosley or Hair Club for men. You know, they get their hair and they're hiking and running.
Absolutely.
And skydiving, dating again.
Dating again.
I mean, do you see that though, where you make a noticeable improvement on somebody's appearance?
All the time.
And they
all
act
the time. That's why I do what I do.
Okay.
It's very gratifying and rewarding. Here's another patient, and now this is just broadband light. Broadband light is a flash of light that's attracted to any irregularity in the skin. Reds, browns, sun damage, melasma, hormonal changes that we have. So this happens with age. Colors pop up. We get, and even in our 30s, 40s, 50s, we start to have reds and browns come up with even some white spots, which is actually sun damage as well. We decided to do the broadband light treatment, which is
like intense pulse light?
Intense pulse light,
okay.
But it's broadband light. So it's just a different type of technology with it, with the cooling system. But what this does is in 10, 15 minutes, instead of using creams and such that you would use for a year, in 10 to 15 minutes, we can take the skin and take all of that color out. The natural, the irregular color, not the natural color. That's
Nice.
another thing with patients. They're scared that their skin is going to look white, waxy, or fake. That you're going to have your natural color, but without the imperfections and without the irregularities.
We're out of time. Final message though, somebody's watching this. They're not happy with the way they're aging. Maybe they have the browns and the red spots, they got bags under their eyes, etc.
Right.
But for whatever reason, they're putting off getting evaluated.
Right.
And for sure they know one thing, they don't want a facelift.
Right.
What do you say to them?
Come into the office. The consultation is complimentary. Get in the door. There are so many different options and treatments that we can do for you. If you're looking in the mirror and you see your mother and we want to just rejuvenate and tighten, brighten and lighten the skin, there's a lot of different things we can do without the downtime. You may not need a facelift. Some people can't have surgery because of medical reasons, or they just don't feel that they're there yet. There are so many non-surgical options that we can take and do and take that skin and just transform it.
Now you're in the business, so you probably think skin's the most important thing.
Of course, but anybody can appreciate beautiful skin.
Okay.
It changes the person. Teeth and skin are two of the biggest things. You look at somebody and they're just radiant and glowing. It just you want to look like them, and you want that to not only show your outside, but your inside too. You want what you're feeling on the inside to show on the outside. And with youthful skin that's radiant and has a lot of luminosity, it just takes you to that next level.
And there's a lot of people doing this. So it's important to look for somebody with experience.
Absolutely. The right laser system, the right systems, and experience, and really being able to look at the skin and see what you need and what you don't need. And that's a real important thing too, and just really diagnosing and seeing what the best treatment plan for you and your lifestyle and what you want to accomplish with your particular goals and needs.
Okay, good. Are more and more men coming in?
They are. Some with
Real men?
Real men.
I'm just
real
kidding.
Men.
I got to go in there. I told you that.
You do. We have to make.
How many
an
years
appointment.
younger could you make me look? Seriously, in your opinion.
In my opinion, well, you look pretty. Well, I would say around the eyes, maybe we can shave off 5-10 years.
Okay.
Yeah.
That's sweet of you. I was feeling pretty good today. No, look, we're out of time. I want to thank you for coming on the show.
Thank you, Randy.
And
It's
it
always
is
a pleasure.
true. I have people from San Diego, Orange County. I tell them they've got to go see you.
Thank you.
So thanks again for
Thank
coming on the
you.
program. We'll see you next time. You're watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.